right, it's not just a growing belly that's changing when a woman becomes pregnant. Here with surprising things that can happen during your pregnancy and what to expect while you're expecting is Dr. Cheryl Ross and mommy-to-be Debbie. So are you already feeling, Debbie, you're already feeling your...
so much. I mean, poor Dr. Ross, I have her on speed dial. She doesn't usually give her patients her cell phone number, and I think she's probably regretted that she's given me hers.
Right.
But, you know, a lot changes.
A lot does change.
All right, so what can she expect? You're in your second trimester.
Yeah.
So what can she expect now?
Well, she's already sort of blown through the first 12 weeks, but nausea and vomiting are probably one of the most common things we see. And
let's just talk about morning sickness for a second. If you don't have morning sickness, does that mean that there's something wrong?
You know, not necessarily. I mean, I like it when women are sick, and I don't remember how sick you were.
I was sick. I was in between segments. I would run off to the bathrooms, and I would have to vomit, and I honestly believed that the audio guys here, I thought they must think I have an eating disorder because I wasn't telling anyone.
Well, why, Doctor, do you like it when women are sick?
You know, because the hormones are high and they're raging, and it tends to be a good sign. But if you're not symptomatic and rushing to the bathroom, it doesn't necessarily mean you have something's wrong.
All right, well, that's good to know. Now, the weight. Let's talk about the weight, because basically, I understand you're supposed to gain between 30 and 35 pounds, because when you talk about the baby weighs how much?
About 8 pounds, 7.5, 8 pounds.
All right, and then your blood doubles in volume.
Exactly.
So that's another 4 pounds.
That's exactly right. Placenta.
The uterus.
Exactly. Those are about 2 to 3 pounds, and then you carry a little extra fat and water retention and the amniotic fluid. It's about 25 to 35 pounds.
So wait, so when I deliver the baby, do you lose 25 pounds immediately?
Everybody wishes.
The answer would be no.
No?
No. You know, but why? Women, I gained 85 pounds.
Oh, dear.
Okay, I know.
That's too much.
All 3 times.
Don't do that.
Yeah, but you know, I know a lot of friends that have gained a lot of weight. One of my friends went up to 200 pounds, but she said the repercussions after were really difficult for her.
And there's diabetes. And
exactly. High blood pressure, diabetes. Yeah. No, she's doing pretty well with her weight gain.
Okay, thank you, because I'm a little concerned because my mother, my friends, they keep saying, why aren't you popping? But you know what? There's a reason why I haven't. I'm going to stand up if you guys can get this shot. I have, you know, if you know me, I'm popping this way. What's going on there, by the way? I think I popped that way. Anyway, but she said because I'm tall, I carry it differently.
That's right. I have my own theory.
What is your theory? Because I've never seen anything like that at 5.5 months.
It's true. Debbie, the taller you are, the longer your torso, the better you hide it, and I think the better you carry it.
I'm just as tall as she was. I looked like a house.
Did you?
I did.
Christina.
Okay, so what are things that are, any unusual things that are occurring right now for you that you'd like to address?
Well, we were discussing that I get these weird feelings in my stomach. Well, the baby is hiccuping.
Yeah, hiccups.
How can you tell?
I don't know. The doctor told me. You have feelings. You have like a feeling that keeps. It's a strange feeling that keeps reoccurring for the 20 minutes or so.
Yeah, it's rhythmic. It's a rhythmic sensation that happens for 2 to 3 minutes, and it's a great sign. It means the baby's getting a lot of oxygen. And
Is it something she may be eating that's doing that?
No, I don't think so.
Okay.
Maybe it was that food you were eating.
It could have been. I don't know, but I've been ravenous. I've been getting a lot of headaches.
Headaches are pretty common too.
Well, she has a headache today, so what is that from?
Well, you know, it depends. I mean, second trimester, we do see a little bit more of it, and just all the blood volume changes. Your heart's pumping so hard right now. So it could be those changes and just some of the unusual changes that happen with hormones.
And some of the common things, she said, as of now, what did you tell me? The baby already has all its
well, 23 weeks, if you're having a girl, and we don't know gender, right?
No, I don't want to find out.
Okay. Your baby already has, if it's a female, has the uterus and ovaries are formed, and you have your full egg supply as of 23 weeks.
Isn't that insane? So it's already predetermined before you're even born, your egg supply. And what about if it's a boy?
The biological clock is ticking. If it's a boy, we know there's sperm present at 23 weeks, and sometimes we can see an erection. It's not unusual.
Inside the womb?
Inside the womb on ultrasound.
Yeah. Oh my gosh.
What can she expect now? She's going to go into the 3rd trimester, because that's when the major changes are going to happen to her body.
It's true. There's a lot more changes, and related to weight, I did get you a little gift for when you do get a little bigger as you get into the 3rd trimester.
Don't be afraid, Debbie.
There's
She's
some
looking at it
scraps.
don't be afraid.
Actually, I'm going to have to give them to you at another visit because I heard you want to be in the delivery room.
Well, yes.
So these I'm going to now give over to you.
Thank you. We plan to be there. We're home and family, so your family is going to be with you.
You can film it. You can film from here up.
Yeah, we will.
Now,
we'll stay out of your way.
I want to. She brought these because she wanted to explain to me that so this is the size of a newborn.
A little bigger. It's
This
a
is
little
bigger?
The baby's going to be a little bit bigger.
A little bit bigger.
The baby's gonna be bigger than
Yeah,
this.
yeah.
Oh boy.
Okay.
Okay, and this is the size of the hips of a real adult woman.
That's right.
So if you could do the honors and
Yeah.
hold this. So this is how the baby has to come
The baby's going to come out. It is, and there's a little stretching going on here. Not quite as dramatic
All
as
the
this.
guys are going, yeah, and it doesn't
Okay.
come out that fast either.
That's right.
No, I got it. No.
That's right.
Okay.
I hope
Wait a
it's
minute.
not easy for you, Deb.
Will the hips go back?
They do. There's a lot of stretching of the ligaments in the joints.
Yeah.
And so this will come back together, usually about 6 months.
It all comes back together, and you get the most precious, wonderful gift that is going to make you
Absolutely.
crazy for the rest of your life
great. That sounds
in a
so
good
exciting.
way. All right, for more information, you can visit our Home and Family website and Dr. Ross's website at drcherylross.com. You're going to do fine, Debbie, and we'll see you in the delivery room,
Absolutely.
doctor.
Oh, my
Okay, Sandy Newton, what do we have today?
Hey, we are looking for some good deals for you, including Debbie. In case you want to go in the pool with the baby, you can take pictures. Come back. We've got great Hollywood steals coming up next.
Thank you. Oh.